Yo, what up, y'all? It's your boy Rob coming back at you once again with another live stream. So, before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get it cracking. All right. So, shout out to everybody who is in the room. It is good to see you all. If you guys can hear me, please give me a thumbs up or radiation emoji in the chat. If you guys cannot hear me, then give me a thumbs down or an angry face. All right. I'm going to shout out everybody that's in the building. We got Carla Lockhart in the building. Shout out to you, Carla. We got Cameron Jones in the house. Good to see you, bro. We got Brooklyn Queen 125. We got my man Carlton Way in the building. And shout out to my man U-Law. And we got Black Manta in here. What's good with y'all? It is good to see everybody. All right. I hope that everybody had a great new year. All right. We're going to start this new year out great as well. All right. So, what we're going to do is we are going to talk about the return. The return of what? The return of a lot of things. The first thing is the return of a new variant. Shout out to my man Robert Taylor, B1. What's good with it, bro? So, they got a new variant. So we're going to talk about this new variant. CDC, new C19 variant, now dominant strain across the United States. It's called JN1. And JN1 is now the most widely circulating variant in the United States, the CDC says. Now, you know what's crazy? Here goes my question. How many people have ever had C19, or how many people have ever dealt with or cared for somebody or been in proximity of somebody that had C19? The thing that makes me so interested in C19 is that they are. Why are they so up on it? Like, you would think that they would track stuff, I don't know, like the flu, or track stuff like the cold. You know what I mean? You would think that they would be all over that kind of stuff more so than they would be on this, because, as we've dealt with this, it's kind of gone away. You know what I'm saying? And really, for the most part, what was happening was a lot of the things that the government was doing to attempt, I guess, to slow down the spread. Those are a lot of the things that caused issues with society, not so much the illness itself, right? But they are still just all over tracking and maintaining numbers and information about this thing. It's just real interesting. I'm just curious as to why. There's a lot more things out there that are far more threatening, if you ask me, and it's just extremely bizarre that they're on this like this. If you guys agree with me, give me a thumbs up. If y'all disagree, give me a thumbs down. So now here it says the U.S. Centers for Disease and Control Prevention said in a recent update that the new C19 variant, JN1, is continuing to spread across the United States, having nearly doubled in the past 2 weeks or so. The agency said on December 22nd that JN1 is continuing to cause an increasing share of infections and is now the most widely circulating variant in the United States, adding that it is now about 39% to 50% of all of C19 variants, whereas JN1 amounted to about 15% to 29% 2 weeks ago. So it spreaded pretty fast. You know what I'm saying? Shout out to Deformed Pretty Boy. What's good with it, bro? Yeah. In fact, if you guys agree with Black Manta, give me a thumbs up. If y'all disagree, give me a thumbs down. That I definitely agree with that. You can tell. You know what I'm saying? As soon as one of these new things come out, they got another new thing, if you know what I mean. So now here it says JN1's continued growth suggests that the variant is either more transmissible or better at evading our immune systems than other circulating variants. So the interesting thing about it is, as these variants continue to change, they either are more transmissible or they're better at evading the immune system. Which, you got to ask yourself this question, right? As long as this has been going on, as many variants as there are, at what point does it become a completely different virus? How many variants have we been through already, and they're still calling this the same thing? You know what I'm saying? So now here it says it is too early to know whether or to what extent JN1 will cause an increase in infections or hospitalizations, the CDC said. We're also seeing an increasing share of infections caused by JN1 in travelers, wastewater, and most regions around the globe, it added. C19 activity across the United States is elevated and increasing, but not dramatically, the CDC said. Historical data shows that the current rash of C19 infections across the country is smaller than previous years' increases. Days before, the UN's World Health Organization listed the C19 subvariant JN1 as quote unquote a variant of interest. So we're back to this. You guys remember what a variant of interest is? Remember, there's two different wordings for this. Well, I shouldn't say two different wordings. There's two different classifications. There's the variant of interest, and then there's the variant of concern. Who knows the difference between the variant of interest and the variant of concern? So now here it says, but it noted there is currently no evidence suggesting it's more severe or a significant health risk. Due to quote unquote limited evidence that is currently available, the UN agency said that the variant may cause an increase in SARS-CoV-2 cases amid a surge of infections of other viral and bacterial infections, especially in countries encountering the winter season, referring to the virus that causes COVID-19. All right. So what they basically mean is that in addition to the cold and in addition to the flu, they're expecting an increase in C19 cases. So now here it says the latest CDC update comes as the agency's director, Dr. Mandy Cohen, said that people who are sick should quote unquote please stay home. However, she did not repeat the CDC's recommendations during the pandemic that everyone should stay home regardless of whether or not they're sick. Avoid spreading germs to others, especially your loved ones who are at higher risk of getting very sick. Also, get tested so you know what you have and can get treatment, she said on X. But despite the classification, WHO says that JN1 likely poses a low risk compared with other C19 variants, which is interesting also because it also seems like as this thing continues to mutate, the risk and the potency of it gets lower and lower. You know what I'm saying? So now here it says the spread of this variant will unlikely increase the burden on national public health systems compared to other Omicron sublineages, the advisory said. However, countries approaching the winter season should be aware that altogether SARS-CoV-2 and the co-circulating pathogens may exacerbate the respiratory disease burden. Now, let me ask you guys a question. Do you all think that the migrant influx will have any impact on this spreading? If you guys think that the migrant influx will have an impact on this, give me a thumbs up and let me know how. If you don't, then give me a thumbs up and let me know why you don't think it will. So now it says JN1 is now listed alongside Omicron variants, including BA286, XBB 1.5, XBB 1.16, EG.5, and BA286, which were deemed variants of interest. The UN agency lists variants under several categories: variants under monitoring, which is the low level, variants of interest, and variants of concern, or the high level. So remember, I had asked that question earlier. So I guess everybody now should know what it is. You know what I'm saying? Oh, yeah, they absolutely bringing that. You remember your boy Brandon Johnson, he said, they're coming here sick. They're coming here sick. Let me say it one more time. They're coming here sick. Yeah, I'm curious. I wonder if they coming here with this. So now here it says, while there might be more cases with the variant, the new variant doesn't pose a greater risk. Andrew Pekaz, a virologist at the Johns Hopkins Bloomberg School of Public Health, told ABC last week. As we observe the rise of the JN1 variant, it is important to note that while it might be spreading more widely, there is currently no significant evidence. All right, so there's no significant evidence suggesting it is more severe or that it poses a substantial public risk. Dr. Jonathan Brownstein, the health innovation officer at Boston's Children's Hospital, told ABC News. Meanwhile, the CDC has said there is no evidence that JN1 causes significantly different symptoms than other C19 variants that are currently circulating. Like with other strains, many people may easily mistake symptoms of a C19 case with other illnesses, such as influenza, RSV, or the common cold, which in this case is one of the reasons why it's not a bad idea for people to get checked. You know what I'm saying? Meanwhile, the CDC has said there is no evidence that JN1 causes significantly different symptoms than other C19 variants that are currently circulating. Like with other strains, many people may easily mistake symptoms of C19 cases with other illnesses, such as influenza, RSV, or the common cold. So now, again, remember, there's also that walking pneumonia that's circulating from China that we talked about that we haven't heard too much more about. Thank goodness. Symptoms of a JN1 C19 infection could include cough, sore throat, headache, muscle aches, fever, loss of taste or smell, runny nose, brain fog, fatigue, muscle aches, and congestion. So that's nice that it causes brain fog. Sounds like something that Joe Biden has had his entire presidency, doesn't it? So now we're going to be talking about another return. And this return is something that is just as annoying as what we talked about before. And what it is that there's 5 states that their hospitals are bringing back mask mandates. Okay? And those states are California, Washington D.C., Illinois, Wisconsin, and New York. Interestingly enough, these are all undocumented bros havens. So now here it says hospitals across the United States are reinstating C19 mask mandates as the JN1 variant becomes the dominant strain spreading throughout the country. Hospitals in California, Illinois, Massachusetts, New York, and Washington, D.C. have all brought back divisive, now look at this, there they go, brought back divisive rules, meaning that masks are mandatory for selected people in medical settings. Now, what they're not telling people is that in many cases, if you work at a hospital, if you don't get the seasonal vaccinations, they make you wear a mask anyway. So this isn't anything that's groundbreaking, or this isn't anything that's new at a hospital. You know what I'm saying? The Centers for Disease Prevention and Control have recorded a 10.4% increase in C19 hospitalizations across America in the week leading up to December 16th. There has been an increase of 3.4% in deaths related to C19 in the same period. Newsweek has contacted the CDC for comment via email. Mask mandates have long been controversial since they were implemented during the C19 pandemic, which reached the United States in early 2020. Medical professionals and the CDC have consistently advocated for mask wearing, including outside of the doctor's office or hospital. Currently, no state in the country has a mandatory mask policy for indoor and outdoor setting. Isn't it interesting how we've changed since 2020? Yeah, facts. Deform pretty boy. Some of those places you can't work if you don't get that poke. You know what I'm saying? This week, Mass General Brigham, the largest health center in Massachusetts, said that effective January 2nd, masks will be essential for healthcare staff directly engaging with patients in clinical care settings until respiratory illnesses fall below a certain percentage. Patients and visitors are also strongly encouraged to wear masks, which will be provided by the hospital, and staff in hallways and common areas are exempt. Mass General Brigham said its policy is determined by the percentage of patients with respiratory illness systems presenting at emergency departments or outpatient clinics. The mandatory masking rule is activated when this percentage surpasses 2.85% for 2 consecutive weeks and will be listed once the rate falls below the same percentage for a week. The Dana-Farber Cancer Institute in Boston, Massachusetts, also said that it would require masks wearing for patients and staff on December 18th. The hospital added that the policy would be in place for the foreseeable future. So they don't even have an end in sight on when they're not going to require this at this hospital here. And that's the Dana-Farber Cancer Institute in Boston. I've never heard of that place. The hospital said on its website, "We check a number of different data points, including rates of influenza-like illnesses, staff absenteeism, and emergency room visits and hospitalizations caused by respiratory viruses. We will lift the mask requirement when these data points remain consistently lower." Staff at MedStar National Rehabilitation Hospital in Washington, D.C. are currently required to wear a mask while at work, according to political website The Hill. University of Wisconsin hospitals and clinics are also asking that people wear masks in its medical buildings, including University Hospital, American Family Children's Hospital, and East Madison Hospital. In New York, NYC Health and Hospitals said there would be a mask policy in place at all of its facilities, adding on its website that C-19 and other respiratory infections continue to pose a threat to all New Yorkers. Hospitals in California are also asking patients, workers, and visitors to mask up. Officials in Yolo County said in a news release that due to a rise in respiratory virus activity in the community, individuals should consider wearing masks in crowded and indoor spaces. Now, here go my question. How many of y'all plan on masking up? If you plan on wearing a mask, give me a thumbs up in the comment section. If you don't plan on wearing a mask, then give me a thumbs down. Amy Sisson, Yolo County Public Health Officer, said our wastewater monitoring program is currently detecting high C-19 and RSV levels. I recommend that everybody in the community take steps to protect themselves from infection, including wearing a high-quality mask when indoors around others. Marin County hospitals have had mask mandates in place since November 1st of this year. In Santa Clara County, masks have been required since April 4th of 2023. In San Francisco, masks are required in hospital settings for all workers in medical fields and in prisons. So there's that, all right? So that is all that we have as of right now when it comes to those new C-19 variants and when it comes to the new C-19 mask mandations that are occurring at those hospitals in those 5 states. So far, not very much. So far, all is clear. But y'all already know that if we hear anything else, y'all will be the first to know. So I hope you guys enjoyed the stream. If there's anybody that's watching that's not subscribed to the channel, try to get this channel to 500 subs. Take a moment, hit that bell. Also, if you guys have not shared the stream to your social media, take a moment, share the stream to your social media. And as always, ladies and gentlemen,
walk up in the life. Yeah, I'm really him. Talking my shit like I'm really him. Hold up. Look, walking this bitch like, hey. Yeah, I'm really him. Talking my shit like, hey. I'm really him. Don't believe me? Come and see me. Got 3 wishes from my genie. Now I'm on your local TV. Y'all on tour. Got demons. Say she wanna come and see me when I'm in a local city. I'm like, pause though. Please step aside so they can see me. And Walk up in this like, yeah, I'm really him. Talking my shit like, I'm really him, on God. Walk up in this like, yeah, I'm really him. Talking my shit like, I'm really him. I'm the realest from my city, that's on my knee, that's on Kiwi, that's on mamas. Niggas don't believe me, come and see me. I been dodging all that fake. All these niggas working broke, but I been getting paid. All that know me from the street. Flexing for a feature, that's like every other week. Talk behind my back, I kick my feet up, have a seat. Cause at the end of the day, all these watching me as I walk up in this like, yeah, I'm really him. Talking my shit like, I'm really him, on God. Walk up in this like, yeah, I'm really him. Talking my shit like, I'm really him, on God. Walk up in this like, yeah, I'm really him. Talking my shit like, I'm really him, hold up. Look, walking this like, hey, yeah, I'm really him. Talking my shit like, hey, I'm really him, hold up.